Sometimes it takes just one sentence to change your perception. As a health journalist, I come across this very often, and I'll share a few with you. Jaggery is as bad for diabetes as refined sugar. Cervical cancer is caused by a sexually transmitted virus. Stress can cause pain in the nerves. All of these sentences made me feel better because I realized I'm suddenly more scientifically aware of the truth. And I realized that I can then use that knowledge to make better decisions about my well being. But there have been some instances when the truth or the reality has just frightened the hell out of me. Last year, I was reporting on a story on tuberculosis for India Today magazine when I came across a lawyer from Bombay. She was from a wealthy family, had never ventured into a congested slum area in her life, and was not suffering from malnutrition. In fact, she had avocados flown in from Mexico and blueberries from California every other week. But during the COVID-19 pandemic, when she got infected, she had a very severe case of the disease, and she had been medicated with steroids, which did cause her immunity to drop. And eventually, she developed tuberculosis. And the doctors feel that the phase when she actually took the steroid medication was probably what caused the bacteria within her to come out of dormancy and start to infect her lungs. So, that old saying, which I've heard so many times in my life, that tuberculosis is a poor person's disease. It happens to those who live in congested slums, have poor hygiene, do not have access to good food, was suddenly no longer true for me. Suddenly, tuberculosis became every person's disease for me. This is Sonali Acharji, and you are listening to Health Wealth, a podcast where we use science and reality to find practical solutions for our health and well being. Tuberculosis is one disease where I've seen more myths than the truth. Firstly, it's caused by a bacteria, not a virus. Secondly, it doesn't just infect your lungs. The bacteria can infect your spine, kidneys, and brain. Thirdly, not everyone who gets the TB bacteria will get the disease. The bacteria can live in your body for decades without making you sick because your own immune system actually wards it off. Now, there are some estimates, like there was one by Dr. Somashekhar N., who is the director of the National Tuberculosis Institute in Bangalore. And he suggested that more than 40% of Indians carry the TB bacteria in their body, but only 10% go on to actually develop the disease. And it is complicated to predict who gets the disease and who escapes it, but it usually happens when your immunity is compromised. Another myth is that TB is treatable. So even if you get it, if you're rich enough, you'll be fine. But that's not also true. We have two very frightening types of TB disease: multi-drug resistant and extreme drug resistant tuberculosis, which are basically bacteria who are so smart that they've just figured out how to withstand most of the TB medications today. And if you get this type of TB, doesn't matter how much money you have, your treatment is difficult and painful. These drugs aren't widely available, they are very expensive, and they cause many side effects. And even with that medicine, you may or may not survive these types of TB. Another huge myth is that TB is only a physical disease. You know, what's the worst? You'll just get physically weakened. But that's not true as well. A 2023 paper studying TB patients in Madhya Pradesh, and this was published in the Journal of Population Therapeutics and Clinical Pharmacology, which is one big line to say, but that study found a very high, almost 55% prevalence of depression amongst TB patients. And another finding by the George Institute for Global Health noted that total treatment cost of the disease is more than 20% of the pre-disease household income. It also found that the unemployment rate increases from the time prior to getting TB to the time when the treatment begins, and that the unemployment actually remains high even 1 year after the treatment gets over. So, this is a disease that does a whole lot more than make you cough. It messes up your mind, your life, and in turn, the lives of those around you. And as a country, the burden of TB remains very high in India. And the government has been taking a whole lot of steps to reduce it, including a very strong promise of eliminating the disease entirely by next year. But if we are to really end a disease which seems to thrive on human ignorance, really, I think it's important to understand it not just from the perspective of government schemes and intentions, but from the view of those who have really lived through the disease itself. And why do I say this? So you don't make the same mistakes. If you can hear from someone who has gone through misdiagnosis, unavailability of medicine, someone who's been trapped in red tape, eaten the wrong food, made all the mistakes possible, and still survived to tell their story, it just makes you more aware. To bring out survivor stories and give us a picture what happens to patients of TB? What do patients really need during treatment? And why is it that a disease which is in principle curable still affecting our country today? I have with me today public health specialist Chapal Mehra. He is also the convener of Survivors Against TB, which is a group of survivors who want to strengthen India's fight against this crippling disease. Hi, Chapal.
Hi, Sonali. Good to see you.
Good to see you. I know you aren't a doctor, but you have been associated with TB for so many years now. I feel quite confident and safe in asking a few of the medical aspects of the disease. So, could you just start with answering one very, very important question? How does TB spread?
Well, TB spreads largely through the air
Mm-hmm.
and is a bacteria. And like you were saying earlier, a very large number of Indians have this bacteria in their bodies, but only a certain percentage uh, it activates and becomes active TB disease. The the question about transmission in a country like India, where we are a very large number and are literally jostling for space, um, it's a difficult one because you never really know when you've been infected, and you will only find out much later when when TB gets activated. Otherwise, many of us live with that bacteria all our lives and nothing happens.
Yeah. No, I remember when I first learned about the TB bacteria being in everyone's body, I went running to a hospital in Delhi called Medanta and I did a latent TB test because I was just like, I need to know, I need to know. But I'm very aware of the fact that not everyone can do that and afford that. So, for an average person, if I'm living in a household with somebody who has TB, how difficult is it to go and get a TB test today?
Well, I mean, if you're getting a latent TB test, it is doable. It is affordable depending on which test you do.
Mm-hmm.
The Montu test is not that expensive. Uh, but it is also a question of realizing that you may live with a person, but you may not necessarily get infected by that person. You may have been infected earlier. So, panic is not the answer. But what you have to do is observe what we understand as a clinical way of doing infection control with the concerned individual. It is also important to remember that after an individual starts treatment, they become non infectious very early. And a lot of people forget that in extrapulmonary TB, which is non-pulmonary, non-lung TB, this is not necessarily an issue. So you're not going to be infectious. So these are very important things to remember.
Mm.
You see, when we talk about something that spreads through the air and we've just come out of a pandemic,
Mm-hmm.
people tend to overreact. So it's really very important to get the right medical knowledge, right infection control knowledge, and also deal with that person sensitively and without any stigma, because that is a big problem in TB.
Yeah. Another problem, and I remember at some point over the years you've mentioned this to me, is that people do tend to get misdiagnosed for TB. Um, Either the fact that the TB is drug resistant, that's not known, or the fact that it is TB is also not known in time. Why does that happen?
You're asking me a very big question, and I can go on and on
And
about it.
so many stories of survivors who've
Yeah.
come out and said that, look, we were treated with the wrong medication for years. What went wrong, and how do we sort of fix it?
I want to take this back to medical education.
Hmm.
And I think the perceptions about TB and who gets TB and who doesn't get TB. So if tomorrow you and I go and sit in front of a doctor and we are coughing, most doctors never order a TB test until all other avenues have been exhausted. You know, they'll treat you for pneumonia, they'll treat you for anything. They will treat you for cough and chest infections for months, but they will not get a TB test. Because I think there is a general perception that a certain group gets TB, right? So, and for some reason, doctors don't seem to order a TB test very early in treatment. So it's very interesting that why should TB be missed? India has the largest TB burden in the world. We also have the second largest burden of MDR TB in the world, but we are still not writing a TB test. Actually, it should be something that you write for every other person.
Mhm.
So that's a tricky question. The second thing is that I think uh, TB is hugely stigmatized. So people don't want to get a TB test. Private sector resists writing a TB test um, because a lot of the dealing with disease is based on human interaction. You know, so a lot of people, you write them a TB test and they don't get it done. So that's also a challenge. And in the case of drug-resistant TB, since you mentioned it, and
Yeah.
India has a growing number of drug-resistant TB cases, it's interesting that people will diagnose you for TB, but they will not diagnose you for drug-resistant TB. Actually, the government also suggests that it should be standard practice now that you should get a MDR TB test done. Uh, but we still find almost every case of MDR TB that we work with was first not diagnosed as MDR-TB. It's exhausting.
Yeah.
When you hear their stories, you realize that they went from doctor to doctor, they took loans, and all somebody should have done is written them an MDR, prescribed them an MDR-TB test right at the beginning,
Yeah.
a drug-resistant TB test. That's a big challenge, and it's also the cause of enormous suffering, damage. It reduces the chances of recovery. All of this is impacted. The more delayed the diagnosis, the less correct the treatment you've been getting. So your body is actually getting sicker, in a way.
Yeah. No, in fact, I feel patient awareness helps to some extent. And, I'm very privileged as as a health journalist. I'm always talking to doctors. And somebody pointed out that a simple X-ray is also a good starting point to get a sense of whether it's TB or not. So I had a family member who had very influenza-like, symptoms. But I didn't ask them to get a TB test. I still said, at least go get a chest x-ray. So it sometimes, even if the doctor is not saying it, you can, through awareness and knowledge, at least guide people towards making correct decisions. And something you said right now is, I think, the starting point of applying that knowledge is knowing that you are not unaffected. It's no longer a poor person's disease anymore, is it?
No, it's not. And this is a myth that, I mean, it largely affects poor people or people with nutritional challenges or congested housing or things. But that myth has been successfully busted in cities like Bombay, in Delhi, in many other growing urban or rather thriving
Yeah.
urban metropolises. And we are very proud of them, right? We speak Bombay is the richest city in the world, Delhi is the center of power. Um, but look at the MDR-TB cases there.
Yeah.
And I'm reminded one day I was sitting in Hinduja in the lab, and a very affluent looking man walked in and said, "These results are wrong. I cannot have MDR-TB." And I was a silent spectator. And then the doctor, a really wonderful microbiologist, explained very patiently to him that it can happen to anyone. And his response was what? I live in an affluent neighborhood. I drive in an air-conditioned car. How can I get TB? But the truth is, TB has no boundaries anymore. We can close our windows, we can close our doors, but we cannot close human interaction. And it creeps across classes, across regions, across geographies before you know it. TB is really the ultimate uh, outsmarter. You know, it's
Yeah.
it's a smart bacteria. You think you're rich, it'll still get you. You think you live in a sanitized house, it can still get you. You
Yeah.
think you have the best nutrition, well, maybe it won't get you, but it may someday when your immunity falls. So there
Yeah.
are many triggers, and this idea that happens only to poor people is a mistaken idea.
Yeah. No, and I also think one has to start respecting bacteria as, this brilliant living organism, and it's been
Mhm.
around for millions of years, way, way before our time. So it's clearly something that's very clever at adapting and getting around to survive. So in that sense, I mean, I think once you start realizing that they might be a little bit smarter than us, you also start realizing you have to take the right steps. Tell me a little bit about Survivors Against TB, because it's a very unique initiative. And I think you're the only one of its kind to bring together survivors and, amplify their voices.
So Survivors Against TB was actually born around 2015, I think. And it was brought together because we were tired of actually having only doctors who were largely, I want to say, male, um, dictating how policy is made, policy is formed. There were never any survivors in the room. And we were constantly told that the survivors of TB are very poor, they are uneducated, what do they need? What can they tell us? When I would raise this in meeting after meeting, that the world really needs to bring in the end user or the end recipient of care into the room. Imagine having a committee on women's rights. Who would it be dominated by? Women, right?
Yeah.
But here is the whole policy universe in tuberculosis where survivors forget about being asked for a meeting, are never even asked for an input. So that was the goal of Survivors Against TB. We started demanding, saying, you have to give us a place at the table. You have to listen to their experiences. We brought one survivor after another to the policy landscape. So, for instance, issues like stigma, issues like gender responsiveness, mental health were never paid any attention to. And um, we were often told that this is the only treatment available. We can't do enough. And I think Survivors Against TB wanted to address all of that. That whether it's a drug stock out or whether it is a stigmatizing treatment, we want to highlight it. And we want to show that TB is more than just a bacteria. It is actually a social and economic
Mm.
and cultural disease, right? It doesn't just affect your body, it affects your whole life and the lives of people around you
Yeah.
and their attitude towards you. So yeah, that was the gestation, and now we are almost in our 10th year and hoping that we can bring more policy change.
Yeah. And using, the experiences that you've had with survivors over the years, could you maybe bring out what this disease does To start with, to our mental and emotional health? What does it do?
Okay, that's a very tough question. I worked with several hundred survivors over the years, and almost everybody has been mentally scarred by this disease. And remember, this is a curable disease,
Hmm.
and many of them don't survive to tell the tale. Some of them do, and all of them carry mental health challenges. Well, the first is, of course, the stigma around TB and the guilt of having an infectious disease, which they carry with them. This is particularly problematic when the person who is affected is female or an LGBTQI individual, because the immediate assertion to them is that something wrong with your behavior. How did you get this disease? Were you a smoker? Were you a drinker? Are you, are you sexually promiscuous? Immediately, society projects those labels at you.
Mm.
So uh, the emotional scars and the mental scars are very, very difficult. The emotional thing is about first being victimized, second being abused, sometimes in your own families, certainly in your community and in your workplaces. Then, of course, there's the side effects of TB treatment, which are very, very toxic, especially of MDR TB. It really changes you as an individual, and you get extreme side effects. It also creates a lot of suicidality, which we don't talk about actually.
Mm.
MDR TB wards, you hear these stories all the time from Bombay, from Delhi, that uh, those affected are constantly contemplating ending their lives. They have to be monitored. So the mental and side effects and emotional side effects of TB actually last you well beyond cure, because some people who can afford going to therapy, but most people really don't know how to articulate. And you see, there's a veil of silence,
Mm.
because the first thing doctors tell you, especially if you're female, is don't tell anyone. Now, somehow it makes the whole process of having this disease dirty, right? Somehow it's your fault. You are dirty that you have this disease. Nobody says, go and seek therapy,
Mm.
but
Yeah.
most of the times, I mean, all the survivors that we work with, for them, sometimes just to articulate what they went through is cathartic.
Mm.
They break down, they start crying, and they say, nobody ever asked us how we went through it, how we feel, and there must be a way. So many of them actually have long-term mental health side effects. They go into depression. Some of them, their relationships break up. There's a lot of abandonment in the case of women and also men. So it's a very toxic mental and emotional space to be in.
Yeah. And you know, to afford a therapist is again expensive, and you're already paying for these quite expensive TB treatment, particularly if it's a
Mhm.
drug-resistant TB. How does this fare on their financial well-being and the economic aspect of TB?
So, by some estimates, TB costs India several billion dollars, I
Mm.
think 24 billion each year or
Yeah.
something, right? And the on all the places, all the stories, if you're not well-to-do, even for middle class and upper middle class people, when they're fighting drug-resistant TB, all of them are into debt. Almost every single person I know, their families had to take some kind of loan,
Mm.
because by the time they got the right treatment, they had already spent 5 to 10 lakhs. They had spent that much, and then the future treatment, because there's a lot of misdiagnosis in the private sector. They write you expensive tests, expensive drugs. You don't get it well, you go to another doctor, then you go to another specialist. It's endless. So there is that impact. Then in most workplaces, it's not welcoming towards TB affected individuals. That is why it's kind of bizarre, because in extrapulmonary TB or even in TB where you're not infectious beyond a point, you're still not really expected to come to work. And it basically breaks your self confidence. You really don't know
Mm.
how to go back to work anymore. It's like I'm not good enough for anything. So a lot of them use it as a stepping stone to do bigger things, but some people can't. So there's a lot of economic. I mean, that's why I say TB is like an economic burden on you for the next 5 to 8 years
Yeah.
because you will take loans and then you will pay them. It's a big economic impact.
And there's also, I mean, obviously there is a physical impact. Um, are survivors, their immunity particularly, does that ever return to the same extent that it was before treatment? And their physical health, does it ever get back, or is that also a struggle?
It's a struggle, but it does come back if you
Mm.
work at it. For instance, one of our survivors and advocates two of them have turned into marathoners
Mhm.
and, kind of mountaineers. But they've pushed themselves extensively.
Yeah.
Another girl that I know, she's very inspiring. She took to powerlifting, and she said to me, I asked her, I said, "You sure you want to take it?" She said, "I've got a second chance. I just want to be my best self physically." So it takes some work because TB is a draining disease. And with MDR TB and also with DSTB, there are side effects.
Mhm.
But you have to really be very motivated to go back to, there's a lot of nutrition that is needed, supplementation that is needed, exercise that is needed slowly. And a lot of it is mental and emotional. Depends on how supportive people are around you,
Yeah.
because that can make all the difference between your choices.
Uh, TB is also a headline grabbing disease in a sense right now, particularly because of the promises made to end it by next year. And, one can't say that, certain schemes haven't been put into place. But from a survivor's perspective, if I were to talk about some of these schemes, could you maybe tell me what's missing or what are the challenges still remaining? So we have a scheme for nutrition because, undernutrition or malnutrition, it's been proven time and again, it not only um, turns the bacteria active because if you are undernourished, there are more chances you'll get TB. But it also hampers your recovery from the disease. So we do have a nutrition scheme to provide some money for better nutrition. Um, is it enough?
No, it isn't. And I'll tell you how much the amount
Mm.
is given to you is 500 rupees a month. Now you're a journalist, you run a home, you tell me, what
Yeah.
will you buy in 500 rupees? So we've been asking for years now. We advocated for this scheme and we recommended to the government that they should at least give 2000 rupees so that people can get basic dal, rice,
Mm.
and wheat in their homes.
Mm.
Enough, because many people have to give up. I mean, a lot of people have to give up employment. And I cannot even tell you what it is like for poor people because I'm just reminded of a case in Rajasthan where I went
Mm.
to meet him. He had free treatment, and I said, "Free treatment se kya fayda hai?" He
Mm.
said, "Free kahan hai? How is it free?" He said, "I spend 100 rupees to go to get the treatment. I spend 100 rupees to come back." He said, "So I have to work to pay for the costs of living or getting the treatment." So the government needs to really expand the nutritional scheme. They've done Nikshay Mitra also, but
Mhm.
really we have enough money. We should be able to give money to TB patients. They are not so large in number. And the truth is that if you give them money during that time, it's not like other diseases where you have to give it for a lifetime. It's just for 6 to 20 months or 22 months. So that's quite doable.
Yeah. We also have, part of Nikshay Mitra itself, I believe, is intended to reduce social taboos. Has that worked?
We haven't seen any evidence on it that it has worked. But I think what we really need to do is large scale, and this is what Survivors Against TB has tried to do, large scale normalization of
Mm.
TB. And the amount of people we get DMs on our social media and on our emails almost every single day saying, I watched so and so film. It really helped me. It made me realize, A, I'm not alone, that I can talk about it. B, that I can be an achiever like many of these people. So I think the first destigmatization has to be for the communities, right? um, because I think TB affected individuals themselves carry so much self stigma.
Mm,
Um, and then there is the social stigma. Nikshay Mitra is good to bring cohesiveness together, to bring
mhm.
affected and non-affected people together. It doesn't necessarily solve the stigma problem. It
Yeah.
doesn't necessarily solve the social taboo problem. It just says these are people who need your help. Well, that's great. But are you willing to accept those people in your homes? That's the more important thing.
Yeah. And also access to medicines, because I remember there have been cases filed by TB patients who say we're not getting access to the right medicines. And now I might be a little incorrect, but I think I vaguely know this, but there is a better TB medication scheme which WHO recommends itself, called BPAL. And I believe that's not available for most TB patients in India, if not all.
So currently, the government is actually working on BPAL, I'm
Mm,
told, and that it is being used, it is being studied, and
mm,
I think they do intend to introduce it. The question, though, is that do we have access to even basic drugs? Because if you remember, not too long ago, there was large news of a stock out nationwide of many
mm,
MDR-TB drugs. Um, and this was particularly so in the private sector, but also in the government sector. Now, the thing is that this is a problem at two levels. First, do you have stockouts and what is your way of addressing them? And second, do you have access to new drugs in shorter regimens? Shorter all oral regimens are available, and I think the government has made some progress on it. But from the point of view of survivors and patients, a shorter, more effective regimen should have arrived yesterday, right?
yes.
Because every single day they have to eat more toxic drugs or take injectables.
Mm,
It is nightmarish. So, our request has always been that don't just make one kind available, make whatever you think your
mm,
expert committees think and what the
mhm.
WHO comes up with as recommended, and actually implement it early. Again, there is a growing number of MDR-TB cases. So the sooner and more quickly you treat them, the more effective your disease control is, right?
Yeah.
The less people out there with MDR-TB, the less people get infected.
Yeah. In fact, I think Bombay did a very good job after the XXDR-TB, which
DR.
was like extreme, extreme drug resistant TB,
Yeah.
which even I was surprised. I didn't know there was something like that. How is Bombay a model example in that sense?
To some extent, but Bombay's problem is that it is a much bigger crisis, right? And that is because it is Bombay. But I think one has to give credit where credit is due. The Bombay administration, the Bombay TB department, the Bombay staff. I don't think I've worked with a more committed set of people, and they go out of their way to make things happen. They have a great relationship with the Bombay private sector. They really work together.
Mm,
These are things that should be emulated across the country
yeah.
because, sometimes when they need tests, they turn to the private sector, and it's a very good, very functional relationship, and it's a credit to actually to the Bombay municipal uh, uh, sort of officers and things
Mm.
because they make it happen.
When you hear the reality of the disease, the hallucinations, the difficulties, the financial impact. And then you just think to yourself that if I'm coughing, it's okay, let me just get a TB test. Why take the risk and allow it to be aggravated? Because it does help a lot to get diagnosed early on. And I think thank you so much for just sharing the stories of survivors that you've come across and, a bit of the reality of the disease, because I really don't think it hits home enough that if you think that you're above the disease and you just decide not to take precautions and not to take the test, that it's going to ruin your life as well.
Yeah, it can affect anyone. I think that's what you have to realize,
Yeah,
that TB really doesn't make a distinction,
no,
right?
it doesn't.
It's waiting to get you, like
Yeah,
many other diseases are. It's really up to you. And I think I'll just end by saying stigmatizing people or stigmatizing a group or being unkind towards them is never the answer, because TB can actually happen to most
yeah,
people. So you have to show kindness, especially to groups that and respect. That human dignity is the most important thing in our lives in a way.
yeah. Thank you so much, Apple. Thank you.
Not at all. Pleasure talking to you.
Of all the TB patients I've spoken to, and they haven't been a lot, around 10 or 12, but there was one who did stand out. And I can't forget her because she ended up giving the disease to her own mother. And she survived, her mother didn't. And she not only had to live with the after effects of not having worked or lived her life for a good 5 or 8 years, but also with huge amounts of guilt. And she said she wished she had known more about TB and how it spreads, because that would have changed her life today. She just didn't know it was so infectious. Do you think awareness can help keep us safe from diseases? And is that something new that this episode taught you about tuberculosis? Do let me know your thoughts. You can write to us at pods@indiatoday.com, or you can message us on 8588966996. This podcast is also available on YouTube, Apple, Spotify, and Google. And if you've enjoyed listening to us, please do leave a rating.